Dearest listener, Chapter 3 of Just Breathe for Caregivers. Introducing our today's guest is Joshua Maggie from Social Benefits Advisors. Joshua, thank you so much for visiting with us today.
Thank you for having me.
We look forward to hearing what you have to say.
Thanks.
It was a pleasure getting to know you over the last few years because you were very helpful in helping my husband, who had applied for Social Security early, but due to health issues, we were trying to get Social Security disability and didn't know how to really attack that, and you were able to assist us with that. And it's been just amazing that we finally have that and don't have to worry about it. He has full Social Security now. How did you get started doing this?
So I previously worked for the Social Security Administration for about 8 years. The first couple of years I worked there, I initially got hired as a customer service representative at the local field office. And then after a few years, I was able to obtain a promotion and go through trainings for claims and things like that. The claims position was much more intense than I originally had anticipated, but it was awesome to learn, all of the ins and outs of Social Security. It did take a tremendous amount of time. It's going through their training program is basically the equivalent to like an associate's degree. So the training itself is in a formal setting, like a classroom type setting. It can be, when I did it, it was virtual, but I know people, they do it in person as well. And then once that lasted about 6 months or so. And then after that, you're on kind of like we'll say a performance plan where they're monitoring all your claims and making sure that you're, being very thorough and following all the policy and procedure and regulations that you're supposed to be doing. And then from there, you kind of get cut loose on your own, and then you start, developing your own claims, and you see all of these various scenarios through Social Security. That was probably one of the biggest things that I learned was, like you really cannot judge a book by its cover. I initially started working in the South Florida area in Boca Raton, so a very white collar area, very corporate. And then when I moved to South Carolina, it was more of a blue collar area. But in between, there's a mix and match of all different walks of life, and there's so many different scenarios that people can have, and that's really what it comes down to is your scenario. And I often use the example that you and your twin sister could have married twin brothers, and their situation is completely different than yours. You might have the same date of birth, but you don't have the same marriage circumstance. You might have different children's circumstances. You might have different health circumstances, work circumstances, and all of those little things will start to determine your eligibility for Social Security benefits, or whether it's retirement, spouse, divorced spouse, disability, things like that. All those little details can make or break your claim.
Well, can a person who is receiving Social Security disability also qualify for Medicaid?
So as far as Medicaid goes, that's one of those unique circumstances, and where a lot of people, at least the people that I've talked to, thousands at this point, it's very important to know the distinction of Social Security, let's say disability, and the other benefits that the administration administers, right? So you have the agency is the Social Security Administration, and under that agency they administer two primary programs. Title II, which is the Retirement, Survivors, and Social Security Disability Insurance, which is based off your work history and the taxes that you've paid from your work. And the other program is Title 16, which is SSI, and that stands for Supplemental Security Income. And the two programs, because the acronyms or the abbreviations are very close, right? So Social Security Disability Insurance, SSDI, that's the one that's based off your work history and your taxes, and then SSI, which is Supplemental Security Income. That program is based off of income and resources, so it's more of a needs-based program. So if you don't have recent work history to qualify for Social Security Disability Insurance, you might qualify for SSI as long as you meet the criteria. And I say all that because it's important to know the difference. When you file a claim for Social Security disability, with that comes the potential for Medicare, which is the federal insurance benefit. If you apply for SSI, it's an automatic application to state benefits like food stamps and Medicaid. So that's where that comes in.
Okay.
And because Medicaid is a state benefit, each state has their own rules and regulations to Medicaid.
Okay.
And so that's where kind of the gray area comes in. I personally have never worked for the state, so I don't like to dive too deep into that. But just in the general sense, if you file for an application for SSI benefits, supplemental security income, with the Social Security Administration, it is also an application for those state benefits, food stamps, and Medicaid.
So a question I'm going to go in. So to get the SSDI, you would have to have worked 40 quarters, correct?
So for SSDI benefits, Social Security Disability Insurance, you do have to be what's called fully insured. So you do have to, we'll say, let me back up, because it does depend on how old you are.
Okay.
So if you're a younger person, whether you might be a teenager working at a grocery store, or a college student, something like that, when you're under the age of 32, there are they call it special insured status. So basically the government acknowledges and appreciates that you haven't had the time maybe to have that 10 years of work or the 40 quarters of coverage. So the special insured status rules, depending on your age, I believe it's off the top of my head, 22, 24, and 32. I could be getting that wrong, but certainly under 32, you have special insured status rules. So you basically, the requirements for work are less. So less earnings, less quarters of coverage are needed. But in a general sense, let's assume that you're over the age of 32. You have to meet two, again, insured status criteria. One would be fully insured. So you do have to have the 10 years of work or the 40 quarters of coverage. And the second would be currently insured status. So what that means is out of the last 10 years from the point that you're saying that you became disabled, you need to have worked at least 5 years. And when I say worked, you have to have earned the credits for those 5 years, right? You have to hit a certain dollar amount. Some people think, sometimes people will get confused between like the Social Security caps. Like right now, if you made $200,000, you're only going to be taxed for Social Security purposes. I want to say it's like $185,000, right? That's something different than getting your quarters of coverage. I want to say in 2026 to earn a quarter of coverage, it's somewhere around $1,800, and you can earn 4 quarters per year, because there's 4 quarters in the year. So it ends up being, I want to say somewhere around like $7,200 for the year. So if in January, let's say that you made $8,000 of taxable wages, then you've earned already all 4 quarters for the year. It doesn't matter if you earned it in December or January in the middle of the summer. Once you hit that mark, you get all 4 quarters.
Okay, and just to clarify, you may have earned the quarters, but depending on how much you earned and pay taxes in determines how much your benefit's going to be when you do collect.
Right, and kind of to go back to your question as well about what makes you eligible for SSDI, let's say that you did have the 10 years of work history, but you retired at like 45, 50, 60 years old, and now you're applying for disability, and it's been longer than 5 years. You could have been making millions and paying taxes on that money through those the Social Security protocols with taxes, but you're fully insured, but you're not currently insured, right? So then you might be looking at a technical denial. That's where Social Security is, they're not saying that you're not disabled, they're saying you don't meet the rules of the program, right? So they're not even going to go forward, they're not going to push your case to the state for a medical determination because you don't meet the basic rules of eligibility. Your work isn't recent enough. And an easy example of this is the Social Security Administration. The easiest way to think of them is they're an insurance company, just like any other insurance company, right? They charge you premiums. How do you pay your premiums? Through your work and through your taxes. You pay your premiums to the IRS tells Social Security that you paid your premiums. So if you stop paying your premiums, just like you stop paying your car insurance, you're not going to have the coverage. So that's the same thing with disability. If you stop working, now you're not paying taxes on your wages, specifically your money from work, right? Sometimes people will get confused. You're not paying Social Security taxes on a pension. You're not paying it on dividends. You're not paying it on investments that you might have.
Okay.
You're paying it on work. or wages is how Social Security
Wages,
will
right.
define it. So that's what determines your eligibility, your benefit amount, all of those things is determined by your wages, right? So again, if you stop working, you're no longer making wages. You don't have any wages to be taxed. So now kind of the time frame starts to, because some people might have a condition, or they might be hesitant to apply for disability for their own reasons, right? Maybe their doctor has told them, a family, hey, go apply for disability, and for their own reasons they just don't. You have a time frame that you can apply, and the technical term would be your date first insured and your date last insured is what Social Security would go by, and all that's based off your work and you hitting those credits. So the more that you work, and if you keep earning your quarters of coverage, the longer that date last insured is going to be pushed out. And once you cross over that mark, right, so if you stop working, that date doesn't move. So, and once you go past it, if you're alleging a disability date that's after that date, let's say a car accident, right? So your date last insured January 1st of 2026, you get into a car accident January 31st of 2026. Well, when you go to apply for disability, they're going to ask you, when did you become disabled?
Right.
You say January 31st of 26. Well, your date last insured was January 1st of 2026. So now that you're alleging a disability that's after that date, you are not currently insured, and therefore you're not eligible for that particular program. SSDI in that case.
So it's important that you talk to someone like yourself before you decide to go ahead and try to apply for Social Security disability on your own. Now I'm going to push this to another part of this. There are a lot of children that have disabilities, and a lot of parents are they don't even think about Social Security or disability or Medicare or any of that other stuff. So one of the things they do is they just like, okay, mom's going to stay home and take care of the child. Dad's working. He's got health insurance, because that's a child that, I'm talking about a child that has severe disabilities and needs mom or dad there, somebody to take care of them. Right. So there's two parts to this question. One is, should they apply for Social Security disability if they've got a medical condition for the child where the child is going to need income, something to take care of them? And the other part to this is that I know from talking to a few people that have done this, that once that child turns 18, it's a lot harder to qualify for the disability as when they're younger. Correct me if I'm wrong.
Right. So there is a difference when a child applies for a disability benefit. The medical decision that's made is for a child. And let's say that they have a favorable medical determination and they're found to be disabled. Once they turn 18, regardless of what type of disability benefit they might be on through Social Security, which there are a few, right? The two main programs are the SSDI and SSI, but there are other categories of disability benefits under we'll say the Social Security disability banner,
Okay.
right? Being childhood disability benefits. Excuse me. So what I would say to anybody who has a disabled child is absolutely you do want to pursue an application for that, especially if they have a severe disability. Some people will be on the fence between certain mental health conditions. I would say the most common, at least in my own personal experience, condition that I saw applications for children were for ADD, ADHD, things like that, where the child had a lot of issues focusing, or maybe it compounded with like a learning disability or something like that. But I would absolutely urge anybody, if you think your child's disabled, go submit the application and see what the medical determination is and go from there. And the reason why that is important is because if you have a child that is, let's say, more severely disabled, maybe they have Down syndrome or autism, something like that, it's important that the child is found to be disabled before the age of 22 not just for any benefits that they might be eligible for in the moment, which realistically would only be SSI for a child. So it would be SSI DC, which stands for disabled child, right? And again, because SSI is based off income and resources, in your example, you said mom's at home caring for the kid, dad's at work, right? So if you have a child that you're thinking about applying for SSI for, just know that the income and resources of the parents would be looked at instead of like instead of just the income and resources for the child.
Right.
So if the child had like inheritance, or they had like a, maybe a trust or something like that, those things can be considered. Maybe not so much the trust, but the thing, Social Security will be asking questions if the child has like a checking account, a savings account, any inheritance, things like that, right? Because those are income and resources. Doesn't matter who it's coming from, they have to know that information. So if in the scenario of the mom's at home caring for the child and dad's at work, they're going to be counting dad's wages. They're going to be counting, let's say mom and dad, they each have their own car. One of those cars is going to get counted. If you had property elsewhere aside from where you live, that's going to be counted. Anything in checking or savings, that's going to be counted. Stocks, bonds, investments, 401k, any financial resources or assets, anything that can be liquidated for money, like a gold or jewelry, they should be asking all, Social Security being they, will be asking all those questions, because that determines the eligibility. So now, if let's say you pass that phase and they push the child's claim to the state for a medical determination and it comes back approved, that's great news for a number of reasons. Obviously, first and foremost would be any state benefits like Medicaid. Again, if a child gets approved for SSI, it's very likely that they are going to be approved for Medicaid purposes as well, maybe food stamps. But again, each state is different. They have their own rules and criteria for those types of benefits. So it does vary. But the most critical thing is fast forward into the future is usually what I try and tell people. So anybody who has a special needs child, one of the very first things that pops into their head is, what happens to this child if anything happens to me? Right?
Yep.
That's the biggest,
yeah.
usually the first thing that comes
Right.
to mind is, what if anything happens to me, who's going to care for the child?
Right.
The financial aspect of it, and so if you have a child that's found to be disabled before the age of 22, and then you think fast forward, let's say the child is now an adult, and the parents are of retirement age, and they file for benefits. Social Security should be asking, do you have any children that have been found to be disabled before the age of 22? Because that child can now apply for benefits under the parent's earnings record, right? And that's where the childhood disability benefits come in, that falls under the SSDI banner.
Right, because that child probably wouldn't have had much of a job, maybe worked some
Right,
part-time and not have had a lot of income.
Right.
So they need to be able to tap the parent's Social Security in order to have an income of some kind.
Right.
And that's what the law says that they can do.
Right.
So if you have a child that's been found to be disabled before the age of 22, then they can draw benefits potentially off that record, as long as that record yields enough, there's enough work history under it to yield a payment to the child.
And just because we are in South Carolina, and I have come across this and dealt with quite a few people that have been looking for this help, South Carolina doesn't do Medicaid for adults. Like able-bodied workers you don't get it.
Oh, I didn't know that.
Yeah, North Carolina does, but it depends on the state. And in
Right.
South Carolina, the only way for a disabled child, even if they've reached adulthood, to get Medicaid is they have to have SSI.
Again, each state is different, and to kind of clarify for anybody watching this too, certain states, in general, it's called Medicaid, but certain states will call it, like in California, it's called Medi-Cal. In Massachusetts, I think it's Mass Health.
It's Mass Health.
Mass Health or something like that. And so each state has their own Medicaid program, and obviously because they receive federal funds for
The program.
for the subsidy of the Medicaid, certain rules have to be met, right? So the federal government basically says, okay, well, in order to receive this money, XYZ criteria, right? So again, maybe the SSI application is a part of that. If you want a federal subsidy to help with your state Medicaid program, then you have to if an SSI application is taken for this person, then that means that they might automatically qualify, or at least at the very least, an application will be submitted on their behalf for consideration.
So the whole reason I brought this point up was because we think of caregiving as in just caregiving a lot of times for an elderly or a sick family member.
Right, not always.
But there are quite a few children that have disabilities that when they're a child, we just take it on and we don't think about it as a parent, especially because we're often younger and we don't think about where it's going to lead to. And it's not till they get to be closer to 18 that people say, whoa, wait a minute, what's going to happen when they get older?
Right,
and
exactly.
So my encouragement is if you have a young child, talking to Josh or someone that does what he does with the Social Security benefits advisor is such a huge thing for you to do while that child is young.
Yeah.
I mean, when they're 14 years old, sit down and have a conversation because you might be missing out on benefits.
You might be missing out. It's at this point, I would say it's not just the benefits, but it's being able to care for it's crossing that thing off of your list so you can give your child or whoever that dependent might be, just in general. It's one less thing that you have to deal with, right? It's out of the way. So again, kind of going back to it, if you have a child that's disabled, submit the application. If they approve it, fantastic. If they don't, you tried. Go through your appeals rights that you might have. But let's assume that you applied for the child's approved, and they're a minor. Then when they turn 18, they'll get a letter saying, okay, now we have to make an age 18 determination. So now the rules are going to change because you're no longer a child.
Right.
Now you have to meet the rules as an adult for this to keep going.
Yeah.
Okay? So that should happen. Doesn't always happen right at 18 because you're essentially waiting for a representative, whoever has that case in the office.
Yeah.
They're going to have to do a review and then send some letters and things like that, right? So I've seen where it's not always 18, sometimes it's 19, sometimes it's 20, but eventually it catches up. And they'll say, okay, we need this new determination. And during the interview for that, they should be asking, right? Because realistically, they're going to be, the beneficiary is the child. Maybe they're talking directly to the beneficiary. Maybe they're talking to a representative payee, which is, in a lot of cases, is the parent, or it might be a grandparent. It might be an aunt, an uncle, something like that.
So explain what a representative payee is, because the average person isn't going to understand that term.
So a representative payee is simply they're just they're the person that manages the benefits for the disabled, for the beneficiary, right? That's where if it's a minor, obviously they're always going to have a representative payee. With there are some exceptions to that, but typically a minor is going to have their own payee. An adult could have their own payee if they're found to be incompetent, incapable, incapacitated, something like that. Then it's just that the representative payee is managing the benefits for the person. They're responsible for any reporting responsibility. So did the beneficiary move? Did they change their phone number? Did they change their mailing address, their physical address? Did they go to work? That's probably the biggest one. Even if the work isn't significant, it still needs to be reported. That's, I would say, the number one reason for overpayments in Social Security is unreported work. And maybe, again, it doesn't have to be significant work. Maybe they're working 1 day a week because they found a job at Goodwill, and the hiring manager at Goodwill wanted to help them out, appreciated the situation, which is it's very often the case too, especially with Goodwill. But another back end reason why it's important, again, going to that fast forward scenario, the parents are maybe applying for retirement benefits. Maybe the parent applied for a disability benefit and they're at a younger age, or maybe one of the parents passed away. Something traumatic like a car accident or something like that, something sudden, or even an illness, like a cancer or something like that, and it's still a younger family. So kind of going back to what you said about caregiving, a very common question is, let's say I'm caring for somebody that's receiving Social Security benefits. Can I receive a benefit? Most people will tell you no. But that's not always the case. There are limited circumstances where there is what some people might call a caregiver benefit. It's called child and care benefit. And if you have a situation where you have a child that's under the age of 16 is drawing benefits off of a Social Security record. So this has, and to clarify, this particular benefit does not exist with SSI. So if somebody's applying for SSI or receiving SSI and they're watching this benefit does not exist within the SSI program. But on the Social Security side of things, if you have a child that's under the age of 16 and they're not, even if they're not disabled, and you have a parent that's maybe not working or working below Social Security's restrictions, they can also potentially also receive a benefit as well under that record. So a scenario, let's say that you have a married couple and they have a child, a minor child, and then let's say the husband passes away and the child's eligible for a Social Security benefit. The child's under the age of 16, and then you have mom who is maybe working part-time because she's also she's by herself. So now she also has to raise the kid and school drop off, maybe other things like that. So with her work being under the limit, the child is receiving a benefit, the parent can also apply for a benefit. And this is probably one of the most, how to put this, I don't want to say underrated would be the wrong word.
Underutilized?
Underdeveloped
Okay.
claims that Social Security has, meaning Social Security, through their interviewing process of taking the application for the child, they should have recognized that other parent might be eligible and either take an application or send a notification that parent is eligible, and they don't. So that creates potentially what they might call an open application. So they were fully aware during the claim of one person that another claim for another person could have been taken, and they failed to do so. So
When you say they, you're talking about the Social
Security, right? So
okay.
if I'm Social Security, I'm interviewing you,
right?
I'm talking to you, the parent, and we're taking a claim for your child, and you're telling me I have, obviously now in that scenario, my spouse has passed away. We're taking the claim for the minor child of the deceased.
Right.
I was married to that person, and we share this child. It's not like a stepchild,
right.
Something like that. And even still, but especially they're taking the payee application for you as well. So they're getting to know you on enough basis to know, because during the payee application, they're asking you, are you working? Does the child live with you? Do you have a different mailing address? Who do you work for? Things like that, right? And they have obviously your personal information as well, like your Social Security number. So they should be able to look up and see the wages that you're making,
right.
and the fact that you're talking to them about an event that created the entitlements, right? The event was the person passing away.
Right.
So now they're not just talking to you as a mom of a child, they're also talking to you as a young mother would be the appropriate, if you did receive the child in care benefit, that's what they would refer to you as, a young surviving mother. But then you're also a widow too.
Right.
So they should be informing you of your rights in the future as a widow.
Right.
Right? Now, obviously that's a different topic, but when they're doing that interview with you, it's their job, right? That's what they get paid to do.
Right.
It's their job to identify who you are and the circumstances of your family dynamic, to know here are the benefits that you're, not just your child, but you're eligible for now and in the future. That is the entire purpose of their job. And unfortunately, in many cases, again, the claim is underdeveloped, where you made an appointment for the kid, we are taking an application for that child, and that's all
And that's all they're doing.
That's all we're doing.
So it's important.
That's what you asked for.
Right. So it's important that you follow up on that and make sure that you ask the questions ahead, just to make sure that you're getting everything that you're entitled to. Right.
And that's probably a good way to put it too. That's a very good way during the course of your application when you're speaking to somebody, whether it's on the phone or in person, you should be expressing that very adamantly. What am I eligible for now or in the future for the both of us, or maybe it's just you, and I hate to say this, hopefully you get the right answer. Right. Part of it is you certainly want to do your own due diligence,
Right.
because that's the other aspect of it too. Is Social Security is very much the burden of proof lies on you, right? So you're coming to even though their procedures say that they're supposed to develop it, you're coming to us because of a circumstance. So you should be addressing any concerns that you have, and so by you saying, hey, what all benefits, not just what I asked for,
Right.
is there anything
Anything
else
else,
that
right.
you see that I might be eligible for is very critical.
Right.
This explains why your role changed, because you worked for Social Security and now you've left there and you're a benefit advisor to help people because
Right.
you saw the drops and saw that people needed help and weren't getting the help.
Working at Social Security again was a very big eye opener, and it was very frustrating to see the same mistakes over and over again with really no accountability. And the accountability is what's going to make the change, right? So I can distinctly remember seeing in the two states that I worked in, I was more of a junior person in both of those offices, and I tried just through my own personal circumstances with my family. I have my oldest brother initially started on SSI benefits. He got into a bad car accident when he was 19 years old, and he worked under the table at like restaurants and stuff like that. So on paper, he didn't pay the taxes to be eligible for SSDI, so he started on SSI. And then when my parents went to go retire, right, the natural progression of things, ended up receiving childhood disability benefits because he was found to be disabled before the age of 22 with that SSI application in his car accident, and then eventually wound up with a higher benefit under my parents' record because they had the 40, 50 years of work history to be able to do that. And then when they initially did that, they did not talk to my mom. And everything that I just went over with you about the child and care application, they looked over with my mom in the very same way. Eventually it did catch up through a review where they did recognize that, hey, mom should be on these benefits too, and took the application and back paid her. But that is not always the case. The majority of the time, it's going to be overlooked, or somebody won't want to deal with it because they'll have to, it's essentially more work for the government employee because they'll have to justify why they're going back. So now they have to do policy and legislation research and be able to cite that. They're going to have to write a report, and it's more work for them in an already overworked kind of scenario.
Yeah.
So in my land where my business that I have with Carolina Health Connections, we deal with Medicare a lot and helping people get Medicare coverage. And wrapping it around the supplements and the advantage plans. When someone goes on to Social Security, there's a waiting period if it's a disability. Correct me if I'm wrong, but it's 24 months from the effective date of Social Security disability?
It depends on your disability.
There you go.
So there are, off the top of my head, there are only two things that will give you instant Medicare, is what some people might refer to it as, and even then there's a waiting period. So the first would be end-stage renal disease.
That was my husband.
End-stage renal disease, and ALS. You get Lou Gehrig's disease. So with both of those, I'm more familiar with the end-stage renal disease. So end-stage renal disease, you don't even need to file for disability. You can file a claim for just Medicare because some people just need the Medicare for dialysis, and they keep working.
That's what we did, but he couldn't work anymore because he was in end stage and he was disabled because he lost the use of his hands. So I had to take care of him for 24 hours a day.
Right.
I ended up, being his caregiver.
Right.
But it took Maria said it didn't take that long, but for us, he was laid off in August. This was during COVID. He was laid off in August of 2020. He got sick in November. We didn't know he was going through end-stage disease at all until he couldn't walk. It just happened like that.
Right.
He couldn't walk. I ended up calling 911, took him to the hospital, and that's when they diagnosed him. They said he has to do dialysis. He started right away. He ended up, losing the use of his hands while he was in the hospital. the hospital staff, tried to guide me as to what to do because
Right.
we didn't have the insurance anymore.
Right.
So they told me to go to Social Security, let them know what he has,
Right.
so you can get your Medicare, so that you can start paying for dialysis. It turned, we got the Medicare in February of the following year. They wouldn't, as far as I know, they did not backdate to November.
That makes sense.
And they said they wouldn't do that because he didn't actually get qualified until
Right.
February. So that was my experience of getting a huge hospital bill,
Right.
from them saying, well, he didn't have insurance and he had dialysis while he was here, and
Right.
he was in there for almost 3 weeks.
Right. And another important thing, again, because I never worked at Medicare, I'm not fully versed in that particular aspect of like coverage and things like that. But as far as I know, there is a difference between having Medicare for end-stage renal disease, ESRD, and then like age-based Medicare. It's not. It's a completely different application process, and as far as coverage goes, I'm not sure if the ESRD Medicare is specific to dialysis only or anything like that versus if you have a wider range of coverage with like age-based or general disability-based Medicare,
Oh, I don't know.
because each one of them has different enrollment periods.
Okay.
I mean, it's all the same kind of process, but you can have most people know that they're eligible for Medicare at 65. Then you have
Yeah, he was 60,
disability-based
right.
Medicare, which is you have a 24-month waiting period. So let's say you broke your back, and then you apply for disability, right? That's going to take some time. Then you're only eligible for Medicare. It's not based off of when you applied. It's based off of when your disability starts, right?
Right.
So let's say that you got into a car accident January 15th of 2026. All right. There's something called the 5-month waiting period, right? And you apply for disability, and they say, yes, you became disabled January 15th of 2026, right? But when you get approved for disability, there's something called the 5-month waiting period, and it's the first 5 full calendar months from that date. So that would mean February, March, April, May, June would be your 5-month waiting period.
Right.
Your disability benefits would start July 1.
It's
Okay.
based on the date of the disability benefits that they start the
Right.
Medicare
It's
24
not when
months
you're
after.
found to be disabled. It's when your disability benefits become
Approved.
effective,
Yeah.
or you become entitled is the more appropriate word to use.
Mm-hmm.
So now, rather than, and it's a 24-month waiting period. So your Medicare would not start in, if you became disabled in January of 26, your Medicare is not starting in January of 28. It's starting in
July 1st.
July 1st of 28. So, that's just like you talked about with your husband. That window there, you didn't have the coverage. Or if you're going through the appeals period, right? That's another important thing to kind of think of. Is so let's say you apply, you get denied, you file your reconsideration, that gets denied, and now you're waiting for a hearing. By the time you get to that hearing, it wouldn't be crazy to think a year and a half has gone by, and a year and a half would be fast,
Yeah.
right? So let's say at the hearing you get approved, your Medicare can be effective with that after that 5-month waiting period, whenever that was. But if you were laid up in the hospital, you got in that car accident January 15th,
Right.
maybe you're in the hospital for 2 months.
Right.
And again, that's what happened to my brother. Again, he got into a bad car accident at 19. Initially, as far as I know, when he got to the hospital, he was deceased. They brought him back, and because of the damage that was done to his brain, he basically had to learn how to walk and talk, go through rehab, PT, OT, all of these
Everything.
things.
Right.
He was in a coma for a couple weeks, and he didn't leave the hospital. I think my mom said his hospital was almost $1 million.
Wow.
But what was able to step in before the Medicare was Medicaid, thankfully, because my mom on his behalf submitted that application. I think she coordinated with the hospital. Usually it's a hospital advocate who say, all right, we need to do this.
So if you're in states like South Carolina where the Medicaid's not approved until the Social Security approves the disability, which is you're not going to get it, that's what we do. We work with
Okay.
clients, and so we will help them look at healthcare.gov. There's no fee for it. We get paid a commission, so it's automatic. You don't have to worry about it.
Right.
We've helped a lot of people that even have been approved for disability, but they were waiting for the Medicare to kick in,
Right.
and we were
The
able to
wait.
help get them the tax credits to get a health insurance policy and get things kicking for them.
Right.
So it's very, very important that if you're starting one process, don't be afraid to reach out to us, because at the same point in time,
Right.
we're going to do the other side of it to make sure you have coverage until that one
Right.
kicks in.
Right. And then this, if anybody watching has ever been in that situation, you know the bills keep coming.
Yes,
The
they
pressure just keeps mounting, and the more organized that you can be, which is another very important thing.
Mhm.
If you're about to jump into that process, I recommend that you go to your local office supply store and get a 3-ring binder and a journal, and start, you know, coming up, maybe go online and find some sort of template to stay as organized as possible.
Mm-hmm.
The more organized you are, the amount of stress that relieves is tremendous.
I agree.
So that is something we're actually working on creating, is like a book,
It's like a binder.
like a binder
Mm.
book that we're working on
Okay.
creating, because for anybody that's disabled, the caregiver needs to be able to keep track of
Yes.
everything.
Right.
Yes.
Doesn't
Right.
matter whether you're a child or an adult or you're elderly, it's very difficult to be able to keep track of things.
Yes.
So we're working on a binder, probably a couple different levels, because it's also, when you're taking care of an elderly person, they need to know when the medications are. So a written medication schedule,
Right.
Right.
from experience, was very helpful taking care of someone.
Mm-hmm.
Not just for me, but for the person that was receiving the care. Because if I wasn't there, they could check their schedule and go, okay, I am supposed to take this medicine right now.
Well, I would even take it a step further and say, you know, you would want to establish one of those binders, or, you know, if you do it on your computer and create a file, but which might even be the better option. But you should have, if let's say that, going back to the, you know, if you have a child that was born disabled, you really want to keep some kind of log of the doctors that they've been to,
Mm-hmm.
when they got diagnosed, especially if it was before, you know, you might have filed the application. Let's say they got diagnosed with autism at like 3 or 4, and you didn't apply until they were like 8 or 9 or something like that. By establishing a binder right away and just capturing, okay, they went to this, you know, here's where they were born, nothing diagnosed there. They went to a pediatrician diagnosed them,
Mm-hmm.
right? You want to make a note of that so you can keep a general time frame of events, not just events, but like, were they prescribed anything? Did they go through any treatments? Did they go through any therapies? Any, you know, what was their plan of treatment? And then as that progresses, you know, if they're born disabled, you might want to keep that going and just start a new binder for every year even.
Well, that's a good segue with these larger hospitals where the doctors are practices, the primaries, the pediatricians are under them. They actually have an online portal where
Right.
all
Yeah,
of the
now they
medical
do.
records are.
Thankfully now they do.
Well, and it's not just now. Like when
Right.
I was taking care of my mother-in-law and I had to apply for Medicaid, I was able to go into the hospital's portal and I found her records back to childhood.
Right.
But not all hospitals keep that detailed of a record.
I was just going to say, that's great,
Mm-hmm.
but you're relying on that provider to maintain those records.
If you're
Right.
starting now, go back and pull
Right.
them while you got a
if,
chance.
If you can pull them now and save them, because
Right.
there's no guarantee, and I'm sure there's some sort of law saying that a provider has to maintain medical records for so long,
For
and then
so
they can
long,
destroy
right.
them. I can't tell you how many people I've helped with a disability claim with, like, yeah, I saw that person 15 years ago, that practice is closed down,
Mm-hmm.
the doctor retired, or they told me flat out, we don't maintain those records after so long, right? So that's where and when you're dealing with Social Security, the burden of proof is on you, right? You're making the claim, literally, you're making a claim, just like you would insurance.
Right.
I'm making a claim that I'm disabled. Social Security is going to say, shows your proof.
Yep.
The proof is on you, it's not on us.
So we're trying to keep moving on
Yeah.
here. So thank you, Josh. I really want to, it's been great. You're a fountain of information.
Thank you.
As we share this podcast, we will also share how to contact Josh
Yes.
so that if you have questions, you'll be able to access that. And we just want to thank our listeners and the upcoming guests that we will be talking to in the next couple of podcasts is a couple of different estate planning attorneys. And unlike Josh, who can help people with Social Security because it's a federal program, attorneys generally work in 1 or 2 counties and 1 or 2 states. So our attorneys are from 2 different areas, one North Carolina, one South Carolina, and they're going to be able to help answer a lot of questions. If you have them, please email us together at justbreathe4caregivers
At Gmail.
at Gmail. I'm putting the website out there, but go to the website, justbreathe4caregivers.com too, and you can catch up with us.
Right.
So thank you and have a great day. We enjoyed it, Josh. Appreciate
Thank you.
it.
Thank you for having me.